Hello again. Do you hear me? Oh, good morning again.
Good morning again.
Do you hear me
Do
clearly?
you hear me?
Good morning. Yes, we can hear you.
Oh, glad. So please get prepared, switch on your...
Doctor, I don't think we can hear you right now.
Is now it's clear?
Yes.
Okay, so I beg your pardon. There was a technical um, problem, but I solved it. So please switch on your cameras. Let's get acquainted. Let's start our practical class. I hope the rest of students will join us in some minutes.
I am messaging the group now. Give me a
Yes,
second.
thank you, thank you. So before we start, I have to inform you that I record every of my lectures and practical classes in order to let the students who are late or who had to go by some reasons earlier, and for further students and for myself as well and my colleague, just to have a reference. So if any of you does not agree to be recorded, inform me. If not, I will continue to record. This is the first thing. So waiting for any responses if you have. And okay, so let's continue. My name. Let me switch on my name in English. Here it is. My first name is Oleksiy. My second name or family name is Kalmykov. I'm professor of the Department of Internal and Occupational Diseases of Kharkiv National Medical University, and I am glad to meet you as your teacher at today's practical class. It depends whether we'll meet later, because I'm not sure that I will remain your teacher at practical classes for all the course of occupational disease, but at least I'm eager to help you with this subject, um, regardless whether I am on our online classes or not. Uh, so, what else? Please switch on your cameras. Let's get acquainted and continue the class. Dear students, do you hear me?
Yes, we can hear you.
Yeah, switch on your cameras, please. We have practical class. It's not the just, I don't know,
Okay, 1
one
minute.
way delivering of something. It's some kind of dialogue. I would be happy to hear from you even something better, if more than from me to you. Okay. While you are preparing yourself, I'll log into the Moodle system of how it is named, a learning management system, yeah, of Kharkiv National Medical University. Okay, and I'll send you the link. Let me share the screen, just a few seconds. Okay, so we have a special course dedicated to occupational diseases. Here is the link. I copy paste it to our chat. Please check and ensure that you have access and enroll in this course, okay? Check the URL I have copy pasted to the chat, follow it, and enroll to this course, and inform that you've done. Oh, dear students, switch on your cameras, please.
Okay, just 1 minute, doctor, please.
Bashar Abdullah Amer, Osama Mohammed, Saudam, Yam Al, Idrisi, Samia, El Hilali. Please switch on your cameras as well. Are you there? Yeah, hello. I'm so glad to see you. Okay, waiting for the rest of students, please, to switch their cameras. Good, thank you. Thank you. Osama Mohammed, Eldrisi Samia, are you here? Switch on your cameras if yes. Samia, please, have you enrolled to this Moodle course successfully already? I've sent the direct link to it to the chat of Google Meet. Let me repeat it for your convenience. If yes, just either type plus to the chat or just tell it orally. Or if you have experienced any problems, also let me know. I'll help you. Who has already joined this course?
Me.
Okay. Who else? Thank you.
Doctor, I will enroll later because right now I'm outside, not in the house.
Okay. When are you going to get to some office or so, some room?
Well, right now I have a class, so after my class I will enroll.
Oh, for instance, could you explain me, everyone, please, what's the situation of this overlap of our class with you and some other? Could you explain how does it happen?
Like how other class with some other, I did not understand the question.
And what kind of class do you have now? I mean, in Kharkiv National Medical University or in some other place?
No, doctor, I'm in Germany, so I'm learning German language.
Ah, it's your local, your some private, your personal class, not according to. I see.
Yeah.
I see.
Yeah.
I see. Okay, okay. So of course, I appreciate your situation. I just need to decide how to conduct our classes. You see, properly. I have an idea. What's about the rest? Are you? Don't you have any overlaps? I mean, the other students.
Yes, it's okay.
It's okay. Good. Anyone else has such a problem?
Me, doctor.
Yes, sir, because sometimes we have practice in hospitals.
Okay, again, I just need your explanation for myself, you see, to build our cooperation with you properly. What kind of, if I correctly understood, classes at hospital? Is it your some personal private practice or according to Kharkiv National Medical University or some other institution? Could you explain, please?
It's not teacher in programmation with our university, but like we try to choose like departments that we have in this year and practice in hospital in our countries.
Okay, I see.
Like it's for them it's like voluntary.
I see. Thank you for your explanation. And there was one more students also telling that there is overlap. Could you explain your situation as well, please?
Situation in practicing.
No. Yeah, you have explained. I'm not sure. Maybe that was Osama Mohammed, right?
Yes, doctor. I am also in Germany and I'm learning the language.
Oh, so also language. Okay, I get it.
Yeah.
I propose the following manner, probably, or just let us agree about the following. I will do my best now to explain the material, the base, at least basically. Your care is to join, to enroll to this course on Moodle base, on Moodle electronic, how it is named, learning management system, yeah, LMS, learning management system, and conduct the rest of studies independently at your time when it is more convenient for you. Okay. Okay.
Okay,
Okay.
sir.
Yeah. A part of this, I'm going to let me show what to do. Just one moment. I hope you see my screen. Just one moment. I'll show you what I do, and I'll send the link to this document to you. Just wait for a few seconds. I'll open it. You'll get by email the link to this document. It is named OCDIS, Occupational Diseases, Practical Class 1 or Pract 1, General and Dust. Yes, so general aspects of occupational disease and dust. Here, I have prepared some kind of, I will change it to English. I prepared the template for your independent work. The principle is so that you primarily join or enroll to this course, use each of these materials present here one by one, and summarize your questions, maybe if any left. If you have some questions, you may easily type them here. I'll see them, answer, and we'll discuss if needed. And make a conspect of general aspects of occupational diseases, of pneumoconiosis and other diseases with prevalent respiratory infections. Let me magnify. I have already prepared the table with main categories, some parameters about each disease in terms of complaints and history, common for each of disease because many of things are common in them, and specific only for appropriate disease. Same for physical examination, common and specific, and additional investigations, common and specific here. And other, anything you want. Maybe that there will be some aspects of diagnosis, treatment, prophylaxis, rehabilitation, or so. And let me then, like this, zoom out. So I have prepared these things for separately pneumoconiosis and propose you already a set of diseases. Let me magnify again. Silicosis, asbestosis, anthracosis, pneumoconiosis of electrowelder, berylliosis, bicyanosis, silicotuberculosis, and fibrosing alveolitis of toxicochemical etiology. These are main representatives of pneumoconiosis. But you may add yours if you are interested in stenosis, I don't know, siderosis, anything of your point of interest or sphere of interest. You may add. You may even add extra rows here, or columns, pardon, columns. Let me see. Here it is, for example. You may add. It's for you. And next part or chapter of this template is very similar, but not the same. Similar table, but dedicated to not lung pathology or parenchymatous pathology, but mostly bronchial, right? It's for bronchitis, it's misprint here. Bronchitis, chronic obstructive pulmonary disease, bronchial asthma, and other occupational disease with predominant affection of what? Respiratory ways. Let me highlight this for you. Here there was pneumoconiosis, right? So here below there is respiratory ways mostly affected. So pneumoconiosis are connected with mostly parenchymatous or stromal changes, and these ones for respiratory ways. I propose you such nosologic forms, such disease as chronic bronchitis of dust etiology, without obstruction, I mean, chronic obstructive pulmonary disease of dust etiology, COPD of toxicochemical etiology and bronchial asthma of occupational etiology. But you may add more depending on your expectations, your interests, etc. For example, they could be cancer, bronchogenic adenocarcinoma, right? And for instance, cancer may be present also in this chapter of pneumoconiosis, because rather often influence of some cancerogenic dust is connected with the high risk of malignization of tumor growth. You may add, no problem. Same, for instance, as someone of students added here silicotuberculosis. We have already silicosis, but silicotuberculosis is different, right? So we have to have it separately. Okay, and next we have here the chapter for tests. It's just same as in your Moodle course. Let me show. Here are the test of first lesson. Is just linked to this place. If I follow the URL, I just come here. And after you have first studied this theoretical material, summarized everything in these tables, or you may add anything more in this document, simply follow this link, answer the tests, and that is. Okay, and I have also supplied you with some advised sources. This doesn't mean that you should use only these sources and nothing more. But at least I propose you to do this. Sorry, I'll translate it into English now. What materials? Study our educational materials from Kalmikov. Okay, this is from me. Let me check if they're accessible. Let me see. Oh, still accurate. Oh, yeah, no, it doesn't. It's good. It's just my private access. Yeah, everything works. Here are they. My presentations for Dust Pathology, for general aspects, and students' research. I have all these presentations already prepared to discuss with you now. So here are they. But you have access to them as well. What questions do you have at the moment regarding my proposition to you? How to conduct your individual study work? What remains unclear for you?
There's no questions.
Could you repeat, please? I'm not sure.
There's no questions.
No questions. Okay.
Doctor, so I have a question.
Yeah, please.
In the Moodle, we should finish up to test 1.
Yeah.
Lesson 1.
Yeah, let me show again. Let me show on the screen. For instance, I'm recording everything now, so I will send you the link to this video. Even you may remind if anything remains unclear. So again, I expect that you go this. Oh, one moment. Let me check. Yeah, entire course of occupational diseases. If you follow this link, enroll to the course, follow all these topics up to first lesson. You see a first lesson. We have 3 topics here, 3 themes, and up to test. Yeah, up to test, and then even you have a clinical case here. I advise you also, but it will open after, you see, after previous chapters are completed. And for instance, I advise you to get later, not for today's class, but prepare for next class using these materials as well. Yeah. Is this clear now? Okay?
Yes.
Yeah, good. Okay, does anyone else have any questions? Can I help you with them? Probably not. If yes, just type anything or simply ask orally. Good. So I'm eager to know more about you. So please, I'm sorry if I not correctly pronounce Your name, Bashar Abdullah Omer, yeah?
Yes.
Could you please represent yourself? I wonder about at least three aspects. First, where are you from? Second one, what is your preferable future specialty in medicine, or not in medicine? Maybe some of students honestly tell that they are going to go from medicine after finishing the university. And third one, what questions, what expectations, how can I help you? So three questions: where are you from? Your specialty? How can I help you?
I'm from Yemen.
Mhm.
Uh,
Nice.
I aspire to get into internal medicine.
Oh, super.
Really, it's interesting, and I would like to know more about occupational diseases because they're usually not talked a lot about in other specialties.
Yeah, I agree with
So,
you. For instance, I forgot to represent this aspect of my career. I'm also an internist or a general practitioner or therapeutic. It depends on, in different countries, they name it in different ways. So internal medicine or therapy is my main specialty. And I must say that it's really useful in my real practice, in Ukraine at least, the fact that I have been studying not only teaching as now, but also studying. I continue to study occupational disease even now, but this greatly helps me because when any of patient or even healthy person enters my office or I have to inspect them, examine, and I know about his or her occupation or position, I already have some kind of understanding, expectations about occupational hazards, the probability and risks of certain diseases or changes of organism, maybe predisposition, etc. I adjust my diagnostic, treatment, prophylaxis, rehabilitation according to the occupation of the person. So in these terms, I really like and love and appreciate the sphere of occupational disease, not only because I am teacher from this department, but because it helps me in my real practice as well. Thank you. Good. It will be more convenient for me to guide you through this material because we have similar or same even specialty in our mind at least. Good. As for the fact that occupational sphere, occupational pathology or medicine is not clearly represented in the literature, in studying material, I agree with you. Yeah, unfortunately, we have a limited number of internationally adopted and recognized textbooks or monographies, etc., and we have to uh, get this material from different sources. I see that Hiba and Jimmy raised hands, so please. Do you have any questions?
No, teacher. I have just joined and I just want to tell you that I'm present.
I see. Thank you. Thank you. I
Thanks.
see everyone. Good. So follow the link in the chat. I repeat it for you, especially. So thank you. Please, Zahra, Lami, what's about you? Same three questions. Where are you from? Specialty and your questions, your expectations, etc. For instance, let me explain why I'm asking you about these three aspects. Where are you from means to me so that I really wonder about peculiarities, maybe some specific things in different countries in terms of my subject, yeah, of occupational disease. And maybe sometimes I will ask you about something and you will explain. Maybe I will read about some peculiarities of, again, our sphere in your country. This helps me to adjust the material better for you and to understand for myself as well. The specialty, because I also want to know how to make these subjects more useful for future doctors. Sometimes I meet exotic, some very specific desires of my students. For example, some of them want to become not even medical doctors, but how it is named, data scientist in medicine, yeah, in healthcare, data scientist in healthcare. And I think it's interesting. I also met such students who has already prepared themselves in, they name it medical marketing. So it's marketing or communications, PR, public relations, I mean, in medicine, in healthcare sphere, or public administration, or etc. See, I could if I would not ask them, I would not even think about such a possibility. But it's also interesting for me to think, to revise my material, my subject from different points of view, and again represent it in. I am preparing the not only textbook but also an online course with videos, with interactive instruments, media, etc., different from what is present on Moodle now. That's why I'm wondering about all this. So sorry for interrupting you. Zahra Alami, please, again, where are you from, your specialty and expectations, questions, etc. How
Okay,
can I?
I'm from Iraq.
Could you repeat,
From
please?
Iraq.
Iraq.
I'm from Iraq, yes. About specialty, it's between surgery or internal medicine. Okay, next year it will be the final decision, which of them. And I don't know. I don't know. And maybe if I choose the internal medicine, it will be helpful for me, the occupational disease, because you know they connect to each others.
Yeah, sure. I must say that.
Or if surgery, no, I don't think. Or maybe I have to connect between them.
Okay, let me comment about this connection. From my experience, at least, I'm not surgeon, of course, but I rather often contact with surgeons of different spheres, general surgeon or some cardiovascular or neurosurgeon, etc. And understanding of peculiarity of the condition of the organism, peculiarities of probably approaches, surgical approaches, many other things, restoration, reparation of tissues in different situations, in different occupational diseases and conditions, might be useful for surgeon as well. Even more, sometimes we have such clinical cases when occupational disease is manifested very similar to typical symptoms probably of surgical pathology. For example, chronic exacerbation of chronic lead poisoning or poisoning with lead may be manifested with so-called lead colic. And lead colic is characterized by constipation, very stable constipation, with pain in paraumbilical in abdomen, paraumbilical region, very strong constrictive pain, etc. And in this condition, unfortunately, rather often surgeons trying to recognize what's happened, they tried some conservative palliative approaches with laboratory tests, instrumental, ultrasound, MRI, computer tomography, etc. And if they do not succeed, and there is one more, even on ultrasound investigation, on MRI or X-ray computer tomography, they reveal the constricted, you see, such a symptom of, I forgot the exact English term for this, let me think, let me translate, acute abdomen in general, I mean, but I mean something more, just a moment, just 1 second. It's intestinal obstruction. Yeah, I forgot the term. Intestinal obstruction. And they tried laparoscopy or even sometimes laparotomy while it is just exacerbation of intoxication, you see. And this incision worsens the condition of the person, the patient, and it's improper generally. But if these surgeons would study occupational diseases properly, they could know that just revealing how they are named reticulocytosis, right? Reticulocytosis and some other inclusions immature forms of red blood cells by complete blood count would already help them to suppose such kind of intoxication and do not conduct the operation. And if they think about this, they could also perform express test for lead in urine, not even in blood, and succeed with primary diagnosis. So some of pathologies is very similar to surgery, to surgical ones, and I'd like you to know these exclusions or these peculiarities as well. Good. Elrisa Samia El Hilali, please. Again, same three questions. Where are you from, your specialty, and your requests, your questions. How can I help you?
Teacher, me, right?
Yes, please.
Okay. Teacher Samia, I am from Morocco.
Okay, great.
And I am in right now. So for the specialty, I think I'm more interested by surgery, like more than medical specialties.
Great.
And for the specialty exactly in surgery, maybe between cardiovascular and the visceral.
And second one, could you repeat the second one?
Visceral.
Visceral. Okay.
Between them, and I can choose right now.
Okay. I have already commented some things about surgery and in few words about cardiosurgery. I rather often I am faced with such clinical cases when some patient with occupational pathology, maybe chronic intoxications with heavy metals or with aromatic hydrocarbons or other different conditions related to intoxications, and with cardiopulmonological pathology, right? Right. Our today's topic, for instance, combination of chronic obstructive pulmonary disease and cor pulmonale, and arterial hypertension and coronary artery disease and etc. Needs or requires special attitude and special approach in cardiosurgery as well. For one hand, for other, many of people who are exposed to some so-called xenobiotics. By xenobiotics, we understand such substances which are unusual in general at all or in certain dosages for the organism, and they lead to development of atherosclerosis systemically. And this also might be more or less connected with your possible future practice in cardiosurgery, if you choose this, of course, choose this way. This in few words. So this also might be useful, at least these two chapters, dust pathology or respiratory pathology caused by occupational agents, and intoxications, especially chronic ones, especially with heavy metals, with aromatic hydrocarbons, etc. Good, thank you. Asama Mohammed, are you here with us?
Yes, doctor.
Could you comment as well in these three aspects? Where are you from, specialty, and your expectations from our classes, from our subject?
Well, I'm from Egypt.
Egypt?
And I'm interested with cardiology in general. And at this time, I hope with you we can have more information about it.
Sorry, I didn't recognize the last of your sentence
Hello.
about the question. I remember about Egypt, about cardiology, and the last one.
Yeah, that's one I said that I hope with you we can learn more information about this specific cardiology.
Let me repeat how I understood, because it was not clear. You might be interested in those things which are related to cardiology, connected with occupational disease, right?
Yes.
Yeah, of course. There are plenty of them. Some of them I have already commented. I mean, this predisposition to atherosclerosis in the majority of cases of influence of xenobiotics. Then respiratory pathology is also always connected, always comorbid with cardiovascular. So it's also very close to my practice because a part of being a therapeutic or general practitioner, I'm actually cardiopulmonologist mostly in my practice. Good. Of course, you'll have a chance to get useful information for you and master these appropriate skills. Thank you. Saudiyam Al.
Yes, doctor, I'm here.
Yeah. What about you? Same things, please. Where are you from? Your specialty and your
I'm,
expectations, please.
I'm from Iraq.
Mhm.
Specialty, I want to enter the ED this year. Specialty here in Germany. Um, and yeah, did you hear me, doctor?
I'm sorry, I didn't recognize the specialty. Could you repeat it and more distantly, probably?
No, doctor, the easiest one, the easiest and less year in Germany,
The
because the situation in Germany is difficult
uh-huh. And
to
the
enter medicine. Yeah,
internal, right? Did you hear?
no, the easiest. I don't know which one is the easiest.
Easiest. No, I heard easiest, but I didn't recognize what exactly. Okay,
Yeah.
I'm not sure. For instance, I just wonder what is the easiest.
Yeah, because here we have to study in German language, which is also hard. If we want to enter here medicine, we have to study in German language, and it's not easy.
I see. I see. Uh,
Yeah.
you see, I'm not sure, of course, but it seems so that maybe if at the beginning, at least, of your career, uh, you might experience some problems in communication in German, right? So maybe some work related to medical statistics, so maybe pathomorphology with some laboratory, I mean, studies, etc., might be one of possible variants where you are not obliged to communicate much in foreign language for you at the beginning, at least. Later you might change your specialty. At least I didn't have my own experience of this, but I just look forwards and then follow up some of my students, some of my colleagues. Many of them choose something what is not related with so hard communication, you see, primarily, and then in a year or two
Yeah.
they proceed with other specialties if they are interested. Good. What's about your expectations from our course?
Uh, I think that we can learn so many interesting stuff, and it's also interesting for our studies in the future, of course.
Mm-hmm. So nothing special, right? Just general.
General, yeah.
Okay. If anytime any of you would have some special idea, let me know uh, by email or else how. I really wonder, I really care to make my new course in occupational diseases useful. You see, I want to automatize it, make it independent from the possibility for students to be online in certain time at certain time
Hmm.
and independent from teachers. You see, I want to like make assistant and simulate teacher in form of artificial intelligence system. Good. Okay. Thank you.
Thank you, doctor.
Okay, Hiba and Jimmy. Are you here?
Yes, doctor, I'm here.
Same three questions, please. Where are you from? Your most probable future specialty and your expectations from our subject, please.
Um, I'm from Morocco,
Nice.
uh,
Glad to know this.
and my medical specialty I'm not sure yet, but probably it would be nephrology.
Oh, good. Thank you. Let me comment. Nephrology. you will see on the second lecture and second practical class a plenty of examples of nephrological pathology accompanying occupational intoxications, especially severe acute intoxications and almost any of chronic. It's affection, so we name it nephropathy, tubular interstitial nephritis, etc. Is typical for intoxication with heavy metals, lead, mercury, etc., with aromatic hydrocarbons and so on. So there is a plenty of probably useful things for you in this relation, specifically in nephrology. But of course, the rest of topics might be also useful. Thank you. So we have discussed these three things with each of you. Let me, as far as I was informed by students who were at the beginning of our class, you still haven't lecture yet, and you were not prepared, therefore, for today's class. That's why I want to make some introduction for you and then send this link for your independent work. Okay? So the next of our some part of our today's class will be mostly like a lecture. Okay?
Okay, sir.
Good, but I need advice from you. Tell me, please, how would you prefer to make a break now and then continue, or can we continue and finish much earlier? As for your choice.
Sure, I think we can continue as well.
What do you think? Could you repeat?
Continue and finish
I
earlier.
think we continue and finish.
Okay. Does everybody agree? Is there anyone who disagrees, who wants to have break? I'm just waiting for your response in any way. Orally.
No, you can continue, please.
No problem.
Okay. I hope I didn't hear from probably Hiba, Jimmy, and Bashar Abdullah. I hope they agree. I hope they agree.
I agree.
Okay. Okay, good.
We
So,
agree, teacher.
good. So I'll go back to our presentation. It's from my lecture, but probably you'll have other lecturers, so you have other presentation. Let me introduce our subject and our department, etc. for you and continue with our today's topic. Just one moment. Here it is. So the exact name of the department you are studying in is Department of Internal and Occupational Diseases of Kharkiv National Medical University. Here's the photo of our former teaching staff before the war began. Unfortunately, many of these colleagues of mine have already died by different reasons, and now we have slightly different teaching staff. We don't have our joint photo because many of us are in different places, not only in Kharkiv, but even abroad and in different other regions of Ukraine. While our clinical bases are clinics of Scientific Research Institute of Labor Hygiene and Occupational Diseases of Kharkiv National Medical University. And here in these clinics, we have mostly pulmonologic with cardiologic profiles of the clinical departments. Plus, we have neurological profiles and ENT, otorhinolaryngological. And this clinical base is dedicated to occupational diseases, subject you are studying now. A part of this, we have two more clinical bases on Railroad Clinical Hospital with pulmonology, rheumatology, hematology, nephrology, and many other. And Regional Military Hospital with gastroenterology, again nephrology, cardiology, and again pulmonology, and many other profiles. Formerly, practical classes were conducted at our clinical base and in classes, but nowadays, unfortunately, we have to conduct them remotely. We have three lectures for you. Oh, it's misprint, of course. Just one moment. Let me correct it. Just a few seconds. Oh, yeah, it's okay. No, it's not okay. One moment. Oops. Yeah. 3 practical classes, and it was expected that students manage real patient and prepare case history. And you can see the thematic plan. It's same as in your Moodle course with the first lecture and appropriate classes are dedicated to introduction and dust pathology, second to intoxications. In this slide the physical agents, but we changed the sequence. Let me change it here as well. Just one moment. Yeah, intoxications and then occupational disease caused by physical agents with accent on vibration disease and deafness, but not only. On your routine classes, while getting excellent mark, it's equivalent to 40 points, for 4, 32 points, and for 3, 24 points. On final control, in order to get satisfactory mark, it's enough for you to answer these 3 phases with practical skills, with theoretical tests and clinical tests. For good mark, varying from 60 to 71 points to answer 10 clinical tasks with open questions. And for excellent mark, from 72 to 80 points, you undergo some oral conversation, oral discussion, basing on, let me show, basing on the following questions. The list of these questions is present in the Moodle course in many places. In syllabus, for example, let me show here. Here are they, just below. Yeah, here are they. They are starting from main aspects of each topic, and then there is a list of questions. Let me see. Here, evaluation criteria, and then exact questions, you see, for each of diseases. And there is a table of the marks, so everything is represented here for you. So, and you may have some additional points to your mark for your independent students' work. Mostly it's connected with research work. What exactly? In our research of our department, at least, we are interested in different aspects of internal diseases, mostly pulmonological, cardiological, comorbid profiles, also vibration disease, and maybe some more. So internal disease and occupational pathology. While if you are interested, if you are proactive about some certain question in which you are interested more than in represented on the slide, you may propose your teacher, me in this case today, and get this topic and conduct your own research in this relation. For example, some of my students, for instance, English medium students, have choose, for example, obstetrical or gynecological aspects of occupational pathology, or dermatological, or even surgical, or otorhinolaryngological. So it depends. If you are really inspired with this, I will support you with any of your inclinations in this relation. I mean, the general idea of what we do in our research in the department and together with students is related to improving of diagnosis, treatment, prophylaxis, and rehabilitation. Maybe in relation to etiology and pathogenesis, maybe in some forecasting, clinical forecasting, maybe in improving of, again, some interventions, both pharmacological, non-pharmacological, surgical, or non-invasive, etc., in rehabilitation. Maybe even in some aspects not clearly clinical medical, but related to maybe AI, I mean artificial intelligence application to the practical work, or to prognosis, to modeling of biological or medical processes. So we have many aspects of this, and I have my own experience in this relation I am eager to share with you. The most specific aspects we have already working on independently from students and together with students are clinical hygienic aspects, so anything related to working conditions. Central hemodynamics is mostly related to cardiology. Maybe it might be useful for you. Immune inflammation, so changes in this relation, systemic inflammation, immune disorders, etc. Mechanisms of fibrosis, endothelial dysfunction, oxidative stress, and genetic factors. Probably I might add here such things as, let me add, AI driven, clinical decision support systems, if you know, decision support systems as a special aspect. And oh, how should I name it? It's AR, VR, ER, extended reality, extended reality in relation to either medical practice or educational things. That sort of extend. I will list them: virtual, augmented, extended, and more reality, etc. And maybe I'll add and other, etc. So let me adjust it. Yeah, etc. Good. The forms of students' participation. In the majority of cases, I try to cooperate with those students who have active position, proactive, and we conduct individual investigations. They might be related to, for example, information and patent research, or collection of own data from real patients, systematization of data, analysis, interpretation, representing in form of publications, etc. And other way is to attend scientific forums, lectures, seminars, sometimes with representing something from ourselves. Few words about general aspects of occupational pathology. By definition, occupational diseases might be spelled or might be explained as a part of clinical medicine, a branch of it, right? Or a group of diseases related to etiological role of occupational hazards, some factors of working process, etc. I'd like you to systematize probably main all the variety of occupational hazards into 5 main groups and 2 additional. This will improve your mastering of these material and occupational diseases in general, and about certain diseases as well. So again, according to International Labour Organization classification, all the variety of occupational hazards might be grouped into dusts, chemical substances, physical agents, biological, and functional factors. Dust may be of different chemical structure, and you might wonder what is the reason to distinguish dust and chemical substances. While their shape, size, and other parameters of dust have these parameters conduct special influence on the organism, and it's practically important to distinguish these separate group of factors from generally chemical. As for chemical, as you might suppose, almost any substance may cause problem to the organism. Almost any. These chemicals may be subclassified into organic, inorganic, but it doesn't matter on this level for us. Then we will discuss more detailedly at appropriate class. Then physical agents, they include everything you have been studying at school about on the classes of physics. They could be increased or decreased temperature, increased or decreased humidity, increased or decreased atmospheric pressure. They could be noise, ultrasound and infrasound, vibration, electromagnetic fields of ionizing, non-ionizing, diapason, etc. Biological. The force is biological. Again, this might be influence of viruses, protozoal, bacteria, maybe even parasites, and many other. And products of their metabolism, for instance, as well. And functional. They could be physical or mental, overstraining or overstressing. While with time, clinicians have revealed that, for example, that in two fields, for example, in allergy or allergology and in oncology, rather often it's impossible to distinguish a proper origin of the causative agent, of the cause, whether it is, for example, in allergy development, it may be caused by different chemical substances and biological, and even sometimes different kinds of dusts may also cause allergic response of the organism. And that's why the experts decided to distinguish some extra subgroup. You see, it's not the sixth group, but it's like separate subgroup, allergic. And similar with cancerogenesis, with oncological pathology. Almost any of representatives of above mentioned 5 groups may cause development of tumor. That's why cancerogenic factors have been distinguished as a separate, again, not separate group, but subgroup. So if we generalize, we have 5 main groups, thus chemical, physical, biological, and functional, and 2 subgroups, allergic and carcinogenic, occupational hazards. The next important thing I'd like you to realize is the fact that each certain factor is characterized by not even certain factor. So each certain factor again may influence on different systems of organs, cause different symptoms, and therefore a main 5 pathophysiological aspects were distinguished. The first one is multiple factor impact. This means that at one and certain working place, simultaneously, plenty of different factors are influencing on this one and certain worker simultaneously. They could be of different nature, they could be of different regimen, they could be consequently or simultaneously, but anyway, every time there is a plenty of factors. For example, even now, I'm sitting here, I have a very sunny day now, and an excess of light from my right side, then I have maybe not very favorable working position. If I would sit for a long time, it would also cause some problems with my organisms, with my health. Then I have overstraining of my vocal apparatus, my mental sphere with teaching again and again of different students, asking them to switch their cameras on and they switch off and I again ask to repeat. So I'm of course joking now, but in general. So then it might be sometimes noisy here, etc. You see, it could be dusty, it could be cold or hot, and etc. And same for almost any place of work. The next and second important aspect of pathophysiology of any occupational disease is monoetiology of each disease. Some former classifications, they supposed a mixed or combined type of etiology, but nowadays the experts all over the world agreed uh, not to associate occupational disease with a group of etiological factors. We start to distinguish them. For example, previously we stated that silicoanthracosis, for example, is an example of occupational of pneumoconiosis caused by mixed dust. But nowadays we state the same diagnosis, silicoanthracosis, but we state it as a combination of silicosis and anthracosis. Of course, it is more complicated than separately, but it is not one disease. It's a combination of two of them. So monoetiology. Each occupational disease is caused by certain occupational hazards. And of course, a group of etiological factors may predispose to development of the disease. Next, polytropicity of the hazards. Previously, on previous slide, I tried to show you that one and same occupational agent influences simultaneously on different foci or target organs in the organism. And basing on this, each occupational disease is polysyndromal or polysyndrome manifestation is typical for them because many different organs are affected. And one of the most important among all these five is the last one, the role of individual peculiarities of the organism in terms of either predisposition to development of some occupational diseases or vice versa, resistance. For example, in the condition of predisposition, even short periods of contact of some person with allergen and sensibilization may result in allergic response, or they could be predisposition or maybe from side of blood and influence of some hematotropic agents, I mean toxicants, may result in sudden and severe damage of blood system or nervous system as well, and etc. Or there could be resistance. For example, not everyone in mines or in foundry or in I don't know, some tunnel working or road workers suffer from the disease even after prolonged period of work, 10 and more years. Not everyone. But even in some cases when there is a high morbidity from dust pathology in some mines, we observe some patients, not patients, but some persons, some workers who does not develop any special disease at all somehow. But while they stay in same conditions with, but not same, maybe hereditary, right? So multiple factor impacts, monoetiology of a disease, polytropicity of hazard and therefore polysyndrome manifestation, and role of individual peculiarities are important aspects of pathophysiology. The next thing I'd like you to realize is different approaches, or maybe are different approaches to classification of occupational diseases. First one is by specificity. It's very easy to understand what is non-specific. There is a plenty. Most of occupational diseases are non-specific or conditional. For example, if we have bronchitis, yeah, in general life, in general population, bronchitis is mostly caused by either smoking or infection or some hereditary predisposition or some maybe pollutants, unfavorable ecological conditions, etc. While in occupational conditions, if this bronchitis, chronic bronchitis, is caused by dust or caused by some chemicals of irritative or toxical mechanism of influence, we stated this chronic bronchitis as occupational. You might wonder, how should we do or how should we act in case if some person smokes and has hereditary predisposition and also undergoes influence of occupational hazards. In this case, we we evaluate each of these components, and if we prove that this certain person has been exposed to occupational hazards exceeding maximum permissible values for enough prolonged time, anyway, we will state this case as an occupational. Of course, taking into account some some how it is named in English, just let me translate. Some burdening, yeah, some burdening influence of smoking and other aspects. But if we prove the influence, intensive influence of occupational hazard, we prove the occupational origin of the disease, even in some combination of causative agents. Specific occupational diseases are subdivided into absolutely specific, or they also named genuine, and relatively specific. The most easy to understand this is just to simply remember that absolutely specific is such a disease which never can develop in non-occupational conditions at all, and there are only two of them: pneumoconiosis and vibration disease, nothing more. And relatively specific is they are those which mostly prevalently develop in occupational conditions, but potentially by some reasons, by some conditions, they may also develop in general population. For example, on this slide, the first example is radiation sickness, right? It may develop in conditions of some accident on nuclear station, yeah, electric station, or in case of nuclear war, right? But the probability of this is so low that it never happens. While radiation sickness in medical personnel, in X-ray diagnostic departments, or in workers of mining, production of nuclear materials, right, and workers of these stations, etc., the probability is higher. It's also not so high, but it's much higher than in general population. If this disease happens in them, we may be rather sure that it's mostly due to occupational origin, but not usual, yeah, populational. The other approach, second approach to classification of occupational diseases, is by etiology. It may be caused, or they may be caused by, as we already studied with you, dust or chemicals or physical and biological agents or overstraining. Let me change the sequence, just one moment, to make it same as we have studied with you previously. Just one moment. Oops, one moment. Let me check what was the previous. Dust, chemical, physical, biological. Okay. Dust, chemical, physical, physical, and biological. Let me change the sequence. Good and good. Maybe like this. Okay. I just want to arrange it in same order. Dust, chemical, physical, biological overstraining. It's okay. So same as we had in classification of hazards. And the last one classification is by systems. So again, dust, chemicals, physical, biological overstraining. Next, by systems, we distinguish occupational disease with predominant affection of respiratory organs, blood, nervous system, digestive system, sensory organs, locomotor, and urinary system. As you can see, not all the list of systems of organs is represented here because at least nowadays, we do not distinguish, do not know at least some diseases with really predominant affection of cardiovascular system or reproductive system or endocrine system. We simply do not know because these systems are more or less affected in any of diseases. That's why we do not distinguish them. And this classification is useful, is convenient for practical clinical application. Diagnosis. Take care about this slide, especially if you wish you may make a screenshot or else what, but I remind you that this presentation is available for you by the link I supplied in the template for your independent work. What is important for diagnosis? The occupation of the person. The experience that medical doctor especially experienced in the field of occupational medicine, just by understanding, by getting to know about occupation of the person already supposes a spectrum of possible problems with their health and may conduct a proper further diagnostic, prophylactic treatments and rehabilitation measures. For example, if we are speaking about electrowelder, right? Electrowelders undergo influence of both welding aerosol and unfavorable posture and physical overload and unfavorable microclimate conditions and chemical influence. And at least this, it's enough already to understand how many risks does he have, right? Or she has. He or she has. And same for almost any occupation. There are even special indexes I met and I have elaborated by myself where I made a conspect of some occupation and most probable insalubrities, right? Hazards and risks of diseases. It's a very useful work for those who are involved in general practice and or therapy, family medicine, etc., or more specifically in occupational medicine as well. Working experience. By experience, we understand the duration, yeah? Not just experience, but also duration. Working experience or duration. Let me adjust. Just one moment. Like this. Okay. Experience. What's wrong? Experience. No, everything is correct. Okay. So by duration, we understand that many of occupational diseases with primarily chronic onset and course, they are mostly connected with, they associated with the influence of about 10 and more years, and only after this some changes develop, and disease develops. Then working conditions. It's extremely important, even sometimes more than occupation or duration of work, etc. Because understanding and proper evaluation of working conditions help us to suppose and prevent the development of disease at all. It's more important than to diagnose and treat when it has developed. In this relation, I'd like to highlight 5 aspects. The first one, we need a list of all occupational hazards some person has been exposed to. Just a list, just the names of them, right? Second one is the intensity, information of intensity of influence of these insalubrities, of these hazards. By intensity, we understand the concentration of some, for example, substance observed, or quantity of some dust in air of working area in grams per cubic meter or something like that. The next aspect, third one, about working conditions is so-called hygienic norm, right? Maximum permissible value. For example, for dust, different kinds of dust, let us discuss in this way. The MPC, maximum permissible concentration, is so it varies from about 1 grams per cubic meter up to 10 grams per cubic meter, depending on dispersion, on chemical structure, on shape of dust particles, and some more parameters. And we should know and compare actual concentrations on the working place, not only concentrations, that this might be the level of ionizing radiation or noise or vibration, etc., with norms, maximum permissible values, maximum permissible concentration or maximum permissible level. And we get this information from sanitary hygienic characteristic, such a document. So again, first one, about working conditions: name of hazards, intensity of influence, norms. Force. Force is probably what information about what prophylactic measures have been performed in this relation, in relation to this certain person or a group of persons. For example, whether they wear some protective masks or glasses or special clothes or shock absorbers, or and many others. Yes, shields against ionizing radiation, air conditioning, ventilation, and many others. Periodical medical checkups, vacancy period, and more. Vacation period. And the fifth parameter of working condition is the quality of these preventive measures. For example, some workers might be supplied with masks, but the quality of these masks might be not enough to filtrate, the air properly and absorb all the dust particles, etc. Or the change of this mask was not proper, or they were not properly performed periodical or even preliminary medical checkups, and many more. All these significantly help us to evaluate the clinical case in relation to occupational origin of the disease, or even in terms of prevention of its development. The fourth aspect of diagnosis of occupational disease is occupational morbidity. It's statistical data about how many workers have already developed some certain occupational diseases from this certain organization, institution. It may be plant or factory or farm or anything else. And of course, if we already know that so many people have already suffered from certain disease, and one more worker from same department admits to us, the probability that he or she has same disease is relatively higher. So this helps sometimes significantly in our decisions. The next three parameters: health condition before work, during work, and after discharge, if this person has stopped working in at some place of work. In typical cases, we observe such a situation when at the onset, at the beginning, in the time of employment, the person was healthy, relatively healthy. Then gradually some changes, some disturbances developed, and then the disease has been diagnosed, or it's our case when we diagnose it. And rather often after discharge, after stoppage of work at some place, the intensity and characteristics of clinical manifestation of some certain disease may be diminished, maybe not so bright. But there are exclusions as well. When after discharge and some period, some latent period, they could be the onset of the disease much later than discharge from the work. So it depends on the peculiarity of some diseases, some mechanisms of influence, and etiology as well. The eighth parameter, what is important for diagnosis, is course of the disease. No, I must even say not only course, but also the onset and course of the disease, both of them. For example, chronic bronchitis. If this bronchitis is caused by toxic affection with irritative action, the onset is acute and the course is remarkable. You see, it's the clinical manifestation is rather intensive, while if chronic bronchitis is caused by dust without this toxic irritative influence, the onset is very progradiate, is very latent, the course is very progradiate, it's not so bright, with very rare exacerbations or not very expressed exacerbations, etc. So same disease, but of different origin, yeah, of different cause, may have different onset and course. Then the signs, identification of signs. I'd like to highlight specific, typical, non-specific at all, right? Let me just, yeah, such a way. So we distinguish specific signs. By signs, we understand not only symptoms, yeah, not only clinical symptoms, but also results of additional investigations. Let me labs and instrumental. Okay. Laboratory studies and instrumental tests. So specific. Not in every case, not in every occupational disease, we have some certain specific, typical only for this, not characteristic for only this certain disease sign. In some cases, we have to base our diagnostic decision on a set of signs, a combination of them. While if we have a specific sign, it greatly helps us in our diagnosis. One moment, let me make some corrections to this. Oh, there is just one moment. Oh, it doesn't work, so why? Okay. Then we have typical, yeah, when there is a set of typical signs, but they may be present in different diseases as well, and we base our decision on the combination of these typical signs. Let me make examples. specific sign, for example, of our today's topic, one of disease of our today's topics, for example, pneumoconiosis is granuloma, yeah, a special type of granuloma. It's very specific for each of type of pneumoconiosis by histochemical and other specific um, investigations, yeah, tests, pathomorphological tests, we may specify this. While in real practice, we usually do not perform the biopsy and pathomorphological evaluation of the cases, and we are satisfied with a combination of clinical manifestation with cough, dyspnea, pain in chest, a set of other signs like emphysematous enlargement of chest and reels and etc. Yeah, and instrumental findings and laboratory etc. and X-ray especially. And this is enough for us to put the diagnosis if we take into account the rest of diagnostic criteria. While, for example, vibration disease even does not have internationally adopted and agreed specific signs. Yeah, we base our decision in diagnosis on a combination of decrease of sensory or sensory motor and vegetative function, so neurological disturbance in combination obligatory with vascular disturbance and optional locomotor system affection, if we prove the effects of other criteria we have mentioned with you already today in this table, which is represented on this slide. And finally, non-specific signs help us not to diagnose the disease itself, but to specify its severity, to adjust our treatment, prophylaxis, rehabilitation, etc. The 10th parameter, let us name it parameters sources of data is differential diagnosis, yeah, and excluding of other causes, occupational or non-occupational, and non-occupational that may lead to development of the disease, right? And the final diagnosis is always provided by a group of experts. So it's usually conducted not by one certain doctor, while with the group of experts. Just one moment. Just one moment. This is okay. I just saved this presentation to the same place where you have already access, just to save my corrections. Good. So these were the main aspects of general issues of occupational diseases. Next one is on this slide is a set of prophylactic measures, both individual and populational, medical and organizational, and many others. And finally, my advice for you, or our, together with our teaching staff, advice for you, what kind of textbooks to use. I'm eager to be in time and prepare a new edition of this, the very first textbook. Formerly, it was edited by Professors Kapusnik and Kostyuk. I'm co-author of this textbook, and I advise this textbook primarily for you because it is all the material in it is adjusted exactly according the program. I mean, studying educational program you use in your studies. While there are also international big textbooks by Rosenstock and Kulin, by McCooney, by Ladu, Levy, Greenberg, McCooney, Moore, as are stated on these slides. And I also advise you to use these international websites of this international organization. Let me, for instance, maybe correct it. And I also supplied some of these and other links in your template for your independent work. Okay. So, dear students, what questions do you have related to specifically general aspects of occupational diseases? For instance, I see that we have one more student, right? Nada Beitar. We haven't discussed with you previously, right? You joined us later. Nada Beitar, are you here?
Doctor, maybe she lost her connection.
Uh-huh.
No.
But if there will be loss of connection, there would be disconnection in this case. But avatar is present, yeah? Okay.
Yes, he's present.
Okay, so I repeat the link to our Moodle course for those who joined us later. What questions do you have in relation to what I tried to represent for you in general aspects?
No questions, thank you.
Mm-hmm. Look here, I also have an explanation, of course, for our second topic of our today's lecture, but there are 123 slides here, and the dust pathology is explained here, I believe, rather thoroughly, and it might be useful for you. I propose you to master this material independently by yourself and simply add your questions if you experience any to these documents, link to which I'll send you by email. Just one moment, let me make some corrections. The link to this document I'll send to you, and there is a special chapter here, questions. Just type your questions here. And if you mention me, you see, I will get informed about this. You may do it as I did now, mention by just in the text, or you may add for example, comment and mention me here. I can't mention myself, but you can mention me, you see. Okay. I propose us to maybe continue with your independent.
Teacher?
Yes, please. Yeah, hello. Switch on your camera, please. Nada Bitar? I believe that you. Oh, yeah, hello.
Hi, teacher.
You have joined later the class, and you will get by email the links to our Moodle course in occupational disease. Here it is on the slide now, or not slide, but the screen, and a link to these documents. And your task, I will describe it in the email, will be to conduct independent work and feel. So primarily read everything and learn everything from Moodle course, and systematize this in the time template in the document. Okay.
Okay, teacher.
Okay. And as soon as we have already met with you, could you represent yourself in 3 steps? Where are you from? What's your most probable future specialization and your expectations from the course of occupational diseases? All this is needed for me to try and improve your studies here. Where are you from? Specialty and expectations.
Teacher, I'm Nada Beitar from Morocco, and I'm actually in Morocco.
Okay. And what's about specialty?
Teacher, I don't know, not yet like my specialty, but I think I want to do something surgical.
Surgical, good. I have already
Yes.
commented some aspects of usefulness, yeah, if not importance of occupational diseases course for surgeons. I am recording everything what is now present on the screen, so I'll send you, each of you, the link to this recording, and you may brush up this in recording. I have commented this. Good. Okay.
Okay,
What
teacher.
are your expectations from the course? How can I help you?
Um, Teacher, like this course will help us to know more diseases and more like frequent diseases. And,
Okay.
yes.
You might get some questions later. Feel free to ask by email or through the documents for your independent work. Okay. Any of you, of course,
Okay, teacher.
not only you
So,
personally.
teacher, now I should go to with the link that you will send to me, and do some works or yeah.
Yeah, yeah, exactly. Each of you, I'll send to each of students from your group.
Okay, teacher. Thank you.
Okay. Okay, do you have any more propositions? Because we have agreed with students at the beginning of our class that we'll conduct it without breaks, finish earlier, and you'll get some independent work. Do you have any propositions now to, or we can continue with your independent work just from now?
No, I think we should start with the independent work.
Okay, okay. So anyway, I will remain here online in case if you need any assistance from me in your independent work. So feel free to ask. Now I simply collect your emails and send them to you. So I stop the recording probably.
Doctor, sorry,
Yeah, please.
just about the deadline when we should finish our independent work.
Let us agree, because I was informed from different students, from you as well, that there is an overlap of our class on some other things in your life. So what would be convenient deadline for you? Let's agree.
I don't know. Ask other students. Let's go.
Just propose.
Maybe till next class we must
Okay, let it be till next class.
must be
Good.
done.
Okay, okay,
Okay. Thank you.
okay. But I'll send now. So I stop the recording now and send it to you as well.